Welcome to all of you who are joining. It's great to see some faces. Please, this is a going to be a very informal session, so please feel free to go ahead and show your camera, show yourself. When we get to Q&A, you can unmute yourself, ask questions, and so forth. Uh, Formally, yeah, welcome to our virtual session on prospective graduate student programs here in environmental health sciences. My name is Tim Devanch. I'm an associate professor here in our department. Importantly, I also have the pleasure of serving as our chair of admissions. So I get to lead the committee that is able to review and learn about all of the wonderful information that you all are providing in your applications to our programs. I'm going to very quickly turn and allow a couple of my colleagues that are joining to unmute and introduce themselves. Dr. Pereiro, could you please go first?
Sure. Hi, everyone. I'm Pini Pereira. I'm a research assistant professor in the department, and I work on more of the environmental effects early in pregnancy to see what kind of happens, what are the mechanisms that's dysregulated by environmental exposures. And I'll hand it over to Rachel.
Hi, everybody. I'm Rachel Yarbrough. I'm the academic program manager. So I am the student services support here in the department. I help our MS, MPH, and PhD students from admission all the way up until graduation. Happy to be here.
Great, thank you so much. And just to make sure folks are clear, if you leave with nothing else from this session, know that Rachel Yarbrough, who just introduced herself, is by far your biggest and best resource going forward. Any questions, clarifications as you're preparing applications at any stage of the process, please don't hesitate to reach out to Rachel. She is an absolute wealth of information. All right, really quickly, this is the itinerary for our session here tonight. We're going to go through and talk about environmental health sciences, what it might be. Specifically, what is it here at the University of Michigan? What type of careers do our students go on to following graduation? Importantly, what are the different degree options? We have several, so we'll spend a few minutes to kind of step through those. What makes a good application, right? So what's the information that we're kind of looking for as we're reviewing and evaluating applicants? And then we'll finish by having a couple of breakout sessions by degree program. So those that are interested in master's degree programs will go into one breakout room. Those that are interested in doctoral programs will go to another. We'll reconvene for one final round of Q&A, and then we'll kind of finish the session today with probably the most rewarding and information based is meeting with our current students, a panel of students that won't have any of myself, Dr. Pereira, or Rachel involved. It'll just be you all with an open session chatting with some of our students. So to get us kicked off, I'm going to pass the baton back to Dr. Pereira.
Thanks, Dr. Dvanch. All right, so since Dr. Dvanch also already said this is more of an informal session, we want to get to know about you and what your needs are, and to make sure that we better serve the purpose of this meeting in the first place. So we are going to prompt today's session with a small icebreaker just to figure out what EHS means to you and what degrees you're interested in so far, and to figure out what your favorite season or holiday is. So I am going to put the 3 questions in the chat. So if you could answer, we'll take a couple of minutes to answer these questions, just to gauge what type of programs you're interested in and what EHS means to you, and your favorite holiday or season. I'll just like say out loud while you're typing up. EHS means figuring out how things work for me. That's what EHS means to me. And I'm not interested in a degree program since I've already completed mine. But I am committed to figuring out what is to kind of like identify what are the mechanisms of environmental exposure and figuring out the unknown of how things work. Favorite season or holiday for me is the summer, because I like warm weather.
While you all are entering your info into the chat, I'm also going to just unmute myself and share mine following Dr. Pereira's. So yeah, environmental health sciences, I don't want to, I'm going to leave that up to Dr. Pereira. She's going to define it for us here in a few minutes. I'm also not interested in degree, although I'm interested in you all applying to our degrees and reviewing your applications. My favorite season, although I do like warm weather as well, is the fall or autumn season. Right now, it's lovely here on campus. All of the trees, the leaves are turning various colors of red and yellow and orange. It's really beautiful. The temperature is cool and comfortable. It's not cold, but it's quite pleasant.
And I'll just jump in real quick since so many people are typing still, and there's some awesome. Oh, great. Oh, all right. Okay, cool. So I'm going to jump in. So I don't have a degree interest, of course, but what I always really like is that my previous position, I worked in admissions. So I primarily worked with undergraduate students only. So I really enjoy working with the master's and PhD students in this position. For EHS, it's been funny how public health is such a big umbrella, and then how EHS is an umbrella, and then how I love that there's so many different interconnections between our department and other departments. I think that's really fascinating that there's so many faculty that collaborate with each other in different departments, students who collaborate. I really like that part of public health, not only just EHS. And I also really like fall, not only for the colors, but I'm a huge hockey fan. So I'm really excited that the Red Wings are back and they're doing really well so far. So that's why I'm really excited about fall. So feel free to keep going on, add more to the chat. It's really exciting to see. But I'll head on over to the next slide for Penny.
Great. Thanks, Rachel. Yes, please feel free to type in as I am speaking about what EHS means in general. So environmental health sciences kind of plays a critical role in prevention. And to do this like work in prevention, we need to understand what are the causes for environmental exposures and their long-term health impact or even immediate health impacts. So looking at this kind of like circle, it- I don't want to call it a cause and effect circle, but it's kind of like interconnected. A lot of you, I saw a type in like public health policy and worker health. So monitoring, preventing environmental health impacts. Sorry, can you go up again? One slide. Thanks. Worker health and figuring out the immediate impacts or the problems linked to environmental health itself, and also mitigate worker exposure to chemicals and potential long-term disease risks for those workers. So that is interlinked to occupational health and occupational hazards. And another piece that is important in our work is figuring out one slide up again, sorry. That we're interested in is figuring out these early life exposure effects and its long-term health. So I work on environmental exposure effects during pregnancy. That is linked to some of these like consumer products and exposure. So I work on lead exposure effects. So in Michigan in 2015, there was the Flint water crisis. So that is an environmental exposure that can have long-term impacts from not just the mother, the offspring, but also the grand offspring. So figuring out how things work and how these exposures impact the mechanisms can help us figure out potential interventions and to figure out ways to reverse some of these harmful effects. Thanks, Rachel. Next slide, please. Why should you choose environmental health at the University of Michigan? These are some of the feedback that we have received in the past. Our faculty are accessible and engaged, and we are committed to making sure that you get what you apply for. What are your goals for applying for these programs, and what are your goals for your careers? And we are trying to give you all the resources and all of the expertise that we can give you to reach your goals. And we are committed to that and we are invested in that. And there are infinite number of possibilities for research. As Rachel and Dr. Dvanch mentioned before, this is a highly collaborative environment. It's not just the School of Public Health. You can collaborate with faculty in the medical school and any other campus institute. Innovative teaching and pedagogy, that's something that you will learn throughout your courses that you take at U of M. And it is an absolute powerhouse. U of M is a academic and research powerhouse. That's why we are one of the top 5 universities in the country. So the interdisciplinary perspectives are kind of interlinked to the collaborative work that we do here. There is a lot of funding resources and funding opportunities as you get into each of your programs. And besides all of this, it is generally a good place to make long-lasting friends, have fun, and enjoy the city as well. At a glance, our department, here's our fall 2025 cohort and EHS students. There are 28 students in our fall 2025 cohort, 84 EHS students. If you categorize them, these are the numbers for all of the degree programs. So you can kind of see about the programs that you are interested in applying for. And some of these students are also here to talk to you at the end of this session as well. And there are 17 core faculty members in the department. 5 faculty have joint appointments, and there are 8 lecturers in our department that collectively help with all of the research and academic pursuits that you come in here to do. So research. There are research programs involved in environmental health promotion and policy, epigenetics, exposure science and industrial hygiene, climate change, cancer prevention, and more. So if these are some of your core interests, which I saw already coming in through the chat, if this is the tip of the iceberg, there's a lot more for you to explore. So if you're pursuing this and trying to figure out how you can get involved at U of M, there's still more to pursue and more opportunities for you to take advantage of. And here are some stats about the 2024 graduates from our department. 96% of our students are employed or pursuing an advanced degree. And 100% of our students have reported being satisfied with their roles. And some of the postgraduate outcomes are listed in the pie chart below, showing that 83% are employed, 13% are pursuing an advanced degree, and 4% are still seeking and a job. But these numbers have changed because this was polled in by the end of 2024, so things might have changed a little bit. And then you can also kind of a preamble to this slide was the employment, like where these graduates go to work. So you can see the educational and research, like academic setting, private setting, a nonprofit organization, government, health system, and more, which feeds into this slide about the common job titles for the graduates for their careers that they have pursued so far. And this is not an extensive list. There's still a lot more careers that this degree will take you. And there's a great SPH careers team here to help support these endeavors. Throughout, if it is an MPH student, you're trying to get an internship as part of your training program, there's resources and help for that, but also beyond graduating from U of M as you become alums. These are some of our school's core values. We value in compassion and empathy. And then we also believe in innovation and quality work. And compassion, innovation, inclusion, and impact work together to make sure that, yes, you're pursuing this degree, but are you okay? Are you able to handle the pressure, and also to make sure that you get what you earn what you wanted to get from these programs and make sure that you achieve your goals. So making sure that there's compassion, empathy, and quality work that feeds into your program. And with that, I will turn the podium to Dr. Dvanch to talk about the degree options and go in depth into our programs.
Thank you so much, Dr. Pereira. Yeah, so let's take about 15 minutes to give an overview of the graduate degree programs that we offer here in environmental health sciences. Essentially, it's the three that you see listed on this slide. We have programs that are part of our Masters of Public Health degrees, programs that are through our Master of Science programs, and then we have a couple of doctoral programs. Next slide, please. So starting with our master's level programs, first question is, what's the difference, right, between a Master's of Public Health and a Master's of Science? So let's start on the right side of that slide with the MPH degrees. These are primarily course-based, right? Meaning in the classroom with instructors. And most of the evaluation is taking place within that classroom setting. As a professional degree program, the goal essentially is understanding current knowledge so that you can then go out and apply it within that professional setting. Importantly, our MPH programs have a required internship that students complete outside of the academic environment, right? So this is at some sort of organization, whether it be private company, multinational corporation, NGO, some sort of local, state, federal government, whatever it might be. And we'll talk a little bit about that internship process here in a few minutes. Contrasting the MPH with the Master of Science or MS degrees, these are primarily research-based. The MS degree program, while it does have some required coursework, has a very large component of evaluation that is based on original research. Students conduct an actual master's thesis. They're formally evaluated by their thesis committee. And the goal is obtaining new knowledge, right? So by conducting original research, hypothesis-driven research, students are trained to become scientists formally. And there is not an internship requirement because our master's students are generally spending their summer in addition to much of their semesters conducting research. One final note, for those of you interested in the Masters of Public Health programs, even though there's not a required research component, you are absolutely invited and welcomed to get involved in a research project during your time at Michigan. Many of our students do this. They learn a lot from the process and end up being really valuable contributors to those research projects. All right, so what are some of the specialty areas? We have several, actually. You would think that environmental health sciences sounds specialized enough in itself. We take it a step further. We do have a general degree program in environmental health sciences, but we have further specializations, those in industrial hygiene, one in environmental health promotion and policy, one that's focused on environment, sustainability, and health, one on occupational and environmental epidemiology, and one in toxicology. And we'll spend a few minutes to step through each of those kind of one at a time. First off, let's take a look at what are some of the basic requirements of each of these degree programs. So for those of you interested in an MPH, and this can be in environmental health sciences or in environmental health promotion and policy, it's essentially a 60 credit degree program. For nearly all students, this looks like 4 full semesters with a summer internship in between year 1 and year 2. This is building a public health knowledge base that all MPH students at our School of Public Health complete. You then have coursework that is competency-based within environmental health sciences, as well as your specialty subplan that you might select. A lot of focus on professional development. Again, this is a professional degree program. You have the required internship, something called the applied learning experience, again, kind of application of what you're learning, as well as something called an integrated learning experience. Next slide. So a little bit more about that internship and applied learning experience. So the purpose of this is, again, this is outside of the classroom, outside of those 60 credits that you're completing, is as a professional degree program for the Masters of Public Health, it's making sure that our students are getting that practical professional experience within an environmental health sciences setting. The internship is often useful. It helps to inform career options and career prospects. And again, it's applying what you're learning in the classroom to real world public health issues. The internship requirement actually has a set number of hours associated with it. It happens to be 168 is the absolute minimum. Students can, of course, complete internships that are much longer or many more hours than this. And then again, that applied learning experience is applying public health knowledge, skills and competencies, and our students produce a minimum of 2 products from their experience. Next slide. All right, so let's take a minute and step through each of these specializations. Some of you might be interested specifically in occupational health, or what we call it here at Michigan Public Health, industrial hygiene. This is very much focused on health and safety within the workplace. So whether it be chemical hazards, biological hazards, physical hazards, all of these things are considered as threats and potential hazards to folks working in any type of employment scenario. Next slide, please. We also have a specialization in environment, sustainability, and health. So this is starting with environmental health as a basis, but then integrating sustainability into it. So a lot of focus on environmental quality, air quality, water quality, right? Doing environmental impact assessments. How does sustainable foods and products fit into this? Building models that help us to better understand the impact of sustainability on health and our environment. Next slide. We also offer a program that's jointly administered with our colleagues in the Department of Epidemiology. This is a specialization in occupational and environmental epidemiology. So students in this specialty are basically conducting analyses that look for associations between exposures to any of these agents, chemical, physical, biological, and the associated health outcomes, right? So what's the impact on health? More directly, again, a lot of statistics, building models, completing analyses. I will note, for those of you that are interested in this program, although we do jointly administer it, in order to apply to it, you would pursue the Department of Epidemiology as the program department that you would apply to. But you would still be taking environmental health science classes with EHS instructors as part of that specialty. We offer an MPH in Environmental Health Promotion and Policy. So this is for students who are equally as interested in learning about the core principles of environmental health science, building that public health foundation, building that EHS foundation, but then going a step further and learning about stakeholder engagement in community and workplace settings as it relates to policy. So as we learn about all of these exposures that we know can adversely impact on health, how can we then mitigate those exposures through the development of effective policy? And as Rachel was mentioning about what she likes about Michigan and its collaborative environment, this is exactly the basis of this degree program. So we are partnering with colleagues in our School of Public Policy here at Michigan, at our law school, at our School for Environment and Sustainability, tying it all together through environmental health sciences to better train and equip students to go out and be agents of change after graduation. Internships. We talked about that required internship within the MPH programs. This slide is only meant to illustrate that internships can take place anywhere you like. There's a great degree of freedom. They can be relatively local here in Ann Arbor, here in Michigan. They can be anywhere in the US. They can be anywhere in the world. Next slide. Shifting gears to our Master of Science programs. So we have programs in environmental health sciences with a specialty in industrial hygiene. We also have an MS in toxicology. As I mentioned previously, there are fewer didactic credits, so less courses that need to be completed, but a bigger emphasis on research, students conducting original research, completing a thesis project with a formalized thesis committee. Next slide. So yeah, with regard to toxicology, this is the one specialty that we haven't really highlighted yet, although in Dr. Pereira's self-introduction, she actually highlighted toxicology. This is the area of work where she has expertise. She talked about her work on lead, right? And so by understanding, assuming that a dose has been received, mechanistically what's going on inside our bodies. How is lead resulting in harmful outcomes to our health? With the goal being that we can then turn around and help to inform interventions to prevent that damage in the first place. Next slide. All right, shifting gears briefly here to our doctoral programs. We offer a PhD in both environmental health sciences as well as toxicology. And while our master's programs, both the MPH and MS, typically take about 2 years to complete, our doctoral programs are more along the lines of 4 years in total. For some students, it's a little bit less than that. For other students, it's a little bit longer than that. Our doctoral students do complete required coursework, but overall, it's a relatively small fraction of their program. Most of the time is spent conducting research. It's a high level research focused degree. This is formally proposing a dissertation, conducting the research, writing the dissertation, formally presenting and defending that dissertation in front of a dissertation committee. Next slide. Additions to your degrees. You have options here, and we encourage you to check them out. On the left side of the screen are dual degrees. So during your time here, you might have a degree in environmental health sciences that you're pursuing, but you could also complete a dual degree with our School for Environment and Sustainability, perhaps do the engineering college, public policy, and more. We have 19 schools and colleges here at the university that, again, are very highly collaborative. There's also something called graduate certificate programs. These are equivalent to they're basically the graduate school version of an undergraduate minor. So while your major or your focus is on environmental health sciences, you can complete a minor or a graduate certificate program that is typically 4 or 5 courses that are cobbled together around a very specific topic. This is not an exhaustive list here on the right side of the slide. It's some examples of graduate certificates that our students in the past have pursued with interest. At the bottom in bold are a couple of those that are administered by our Department of Environmental Health Sciences. That's a grad certificate in risk science and human health, as well as the certificate in climate justice, health, and sustainability. And then, regardless of whether you're here for doctoral studies, Master of Science, or MPH, you have the opportunity to learn, conduct research, complete an internship within a global environmental health context. Our school has great funding through our Office of Global Public Health to allow students to pursue these opportunities. This particular slide is highlighting recent students who have completed internships at, again, this is just not an exhaustive list, it's just for example, many places across the globe. Speaking of financial support, and I will mention that our school of Michigan Public Health will have some additional remote sessions specific to financial support, but we will touch on it here briefly. One of the things that's really important to recognize if you are applying to our master's programs is our first level of review is on whether students are admissible or not. We do a second round of review with that is looking at administering merit-based scholarships. You don't need to apply for this. You don't need to prompt us. We will automatically consider you for a merit-based scholarship. And so your first response that you'll get from us is congratulations, you've been admitted to the program. A few weeks beyond that, you'll get another follow-up that says, hey, congratulations, you've been offered this scholarship in this amount. Our Rackham Graduate School, which administers both our doctoral program and our Master of Science program, it is a great source of internal funds for us to come up with funding to offer to students. We have external training grants through the National Institutes of Health, both for kind of workplace, occupational health based, as well as environment and toxicology based. There are many other organizations that end up offering third-party indirect financial support as well. Our students have the opportunity to apply to be graduate student instructors, right? So maybe at the undergrad level, you're familiar with the term of a teaching assistant. At the graduate school level, we refer to them as GSIs. You can also work temporary, hourly basis. Hey, I've got 8 to 10 hours a week to spare. Those research projects that I mentioned, you might get involved in. It's not just experience. You can actually get paid to work on those research projects. And then, of course, there are more traditional federal aid loans through the FAFSA process. A few words on the application process, and we're just about done here, and we'll move on to some Q&A in our breakout sessions. What makes a good application? Just to let you know, it is a holistic admissions process. There's no such thing as a minimum GPA, grade point average. We're looking at everything that's in your application. Importantly, we do look at whether you have prerequisite courses. This is a little bit confusing, so it's worth spending some time on our website. Each of those areas of specialization, those specialty programs there's some nuance. Some have more prerequisites than others, so pay attention to that. We're interested in your motivation. So when you write your personal statements, tell us about you. Tell us about what drives your passion. Tell us about what hasn't gone well. COVID was 5 years ago, but there's just real life that gets in the way for all of us. It seems like on a continual basis. So don't be afraid to tell us about what's going on. If there's kind of a gap in your professional development or academic record, don't leave it up to us to kind of assume what it was. Go ahead and tell us. Again, we're looking at this holistically. You are required to have letters of recommendation sent along. We ask you to put together a CV or a resume, as well as a quantitative statement. Importantly, we do not look at GRE exam scores as part of any of our evaluation for admission. All right, so what are the next steps? It's to complete your application by the priority deadline. For most of these, this is December 1st, right? So about a month and a half from now. For MPH and MS, it's a priority deadline, although it continues beyond that. The final is May 15, 2026 for the MPH degree. And the MS, we try to be as flexible as possible and accept rolling admission application review after that. The December 1st deadline is hard and firm for the doctoral programs. So we're not able to accept applications beyond December 1st for the PhD programs. Next slide. And then, yeah, this is just kind of a timeline of what to expect after you submit your application. Check your email. This is how you're going to get communication at the master's level. For those of you that might apply early by that priority deadline, hopefully you'll hear from us on admission before the end of December, if not in the early part of January. Otherwise, it will be during that winter timeframe that you'll first hear from us with regards to admission. A month or two after that, usually late February, early March, you'll hear from us on scholarship offers. For doctoral applications, we will get through all of those applications by the end of December. You'll hear from us by mid-January. Those applicants that are determined to be best fits for research with our faculty will be invited to attend doctoral days, which is conducted during the latter part of January. And it's a multi-day virtual session where we learn more about our programs, about our research, and have individual meetings with faculty to help identify best fits for your interests with faculty research interests. Upon being admitted, you can expect to be contacted by one of us, myself and many of my colleagues here at Environmental Health Sciences. We're going to reach out to you, ask to talk about, do you have any questions? You know, what else can we do to pave the road for you to choose by April 15th of 2026 to come and join us at Michigan Public Health. Any questions that folks have? And we probably only can take a minute